Hello everyone, thanks for coming. This is our 13th Seattle Angel Conference.
Next up, Meds for All, Shawn Swanson.
Alright, hello everyone. It's good to see some familiar faces out here. My name is Shawn Swanson. I'm the CEO and co-founder of Meds for All. Today I will be talking to you about why we chose the name Meds for All. Well, we chose this name so we would be constantly reminded of our core value proposition. We aim to bring rescue drug medications to those who otherwise could not have afforded them. Rescue drugs are drugs that can prevent death if administered in time. However, these rescue drug autoinjectors are being sold at extremely high cost, limiting availability, resulting in preventable deaths. I'm sure you guys are all familiar of the Epipen. This thing sells for $300, but the active ingredient inside this only costs 50 cents when in ampule form. Now, why doesn't somebody make an autoinjector that utilizes this form of the drug to make an affordable delivery mechanism? Well, it turns out it's actually a very difficult project that actually involves microfluidics and complicated materials, and that's exactly what we have done at Meds for All. The team behind this innovation is myself as the co-founder and CEO. I work on business development, design, and testing. My co-founder, Richard Lee, works on health economics and regulatory strategy. We have a very active group of mentors and consultants. Dr. Don Downing helped develop Plan B. Dr. Stigachis was a VP for drugstore.com. Christian Ham is an emergency room pharmacist at Stanford Health, and he has offered a potential pilot study at Stanford Health with our device. Alex Cutler recently joined the team as a quality management consultant, as did David Hammond for our regulatory consultant, and Jonathan Copley is our CPA and financial consultant. With that, I would like to show you the world's first glass ampule-based autoinjector, the Epinject. So the way this works is you go to your pharmacist, and the pharmacist will load the device with the ampule. I already loaded this for you, and in the case that you do need to use it, all you do is screw the top. The ampule is now broken down, and now I've activated the microfluidic mechanism that is filtering out the air and the liquid. The correct dose has been achieved. I took the needle out of this. And now the correct dose has been injected. So our real UVP comes in this square right here. In the case that you do not use the drug within the lifespan, which is 1 year, you can go back to your pharmacist and they can simply replace the glass ampule. That means that instead of replacing the entire EpiPen every year, you can simply replace the drug. You can't take the drug out of these EpiPens, so that means every year you're throwing away $600 to replace this. With our device, you're only paying $1 to replace the drug. This solution is much more affordable than our competition because all the competitors, both existing and emerging, are made with the drug in the device. That means that they are technically a drug, so from a manufacturing standpoint, they have much more stringent manufacturing guidelines that increases their cost. Our device is simply an assembly of plastic and springs, thus our manufacturing cost is much lower. This is more cost effective because instead of replacing the device every year, you're just replacing the dollar drug every year. It's more convenient for the user because they can keep the device for up to 5 years instead of going back to the pharmacist and replacing the entire device. We are also patent pending. We have a strong IP position at the UW. Our patent covers the usage of a glass ampule in an autoinjector system. We actually just got our term sheet from Commotion today and are negotiating that with a lawyer, Joe Wallen. The term sheet is pretty straightforward and should be risk-free. We know that Commotion believes in the team. They have already invested $170,000 in non-dilutive funding to the team and have already provided the term sheet. So this should be a pretty straightforward and risk-free process. We also have safety features that we believe are superior to that of the Epipen, but also we can use the device with other medications. We are not a one-product company. This is a generic drug delivery device for ampules. There are a lot of glass ampules that can be utilized with this system, such as naloxone, to address the opioid epidemic. We can also easily distribute this device internationally. Since this is not a drug, the regulatory hurdles to enter new countries will be much lower than that for our competition. And also, our price point will be low enough so that people in these orphan need countries can afford it. That will allow us to tap into untapped markets and address orphan needs. Taking a quick look at competition, there are 4 major players out there, and all of these competitors are made with the drug in the device. That means that their costs to manufacture will be very high, and also it means that you replace the drug upon expiration every single year. Taking a specific look at the Epipen, it costs $34 to make one of these, but it only costs $5 to make one of ours. And like I mentioned, that's because we're not a drug, we're simply a device. We're just an assembly of plastic and springs. And I believe this is going to really eliminate the possibility of a price war. Our business strategy is simple. Because this device is so cost-saving to insurance plans, we want to target them first. We've already spoken with a formulary director at Blue Cross, and he has invited us to present to them once a prototype is ready for FDA submission. Formulary approval is likely not needed for this device because it can exhibit such cost savings to the insurance plan. And he also mentioned that this device will be user insurance reimbursable, and there are existing codes to reimburse the pharmacist for loading the ampule, incentivizing the pharmacy to carry our device. Once covered, we'll see rapid adoption by all of Blue Cross Blue Shield, which will allow us to tap into a large percentage of the market. That means that people under Blue Cross Blue Shield, this will be the preferred device under their insurance plan. If they want this device, they simply pay a copay. If they want the Epipen, they pay a $600 cash price for 2 of them. That will lead to quick adoption in these areas. We also have a very straightforward ready-to-wear strategy when compared to our competition. Instead of a drug-device combination, we are simply a 510K Class 2 device. This will provide a streamlined and quick ready-to-wear pathway that will require minimal testing and capital to get through. We're submitting our pre-submission with David Hammond in June of 2018. The market size here is massive. 6.3 million auto-injectors are supposed to be sold this year, and the estimated size for the market this year is 2.4 billion. How does that relate to our financials? Well, you can see in 2023 that we have estimated revenue of $100 million. Diving deeper into this, the market report said that the market size was 1.86 billion in 2016, with an estimated cumulative annual growth rate of 13.5%. That means the estimated market in 2023 is 4.4 billion. Now, considering that one of our competitors achieved 18% market penetration in 1 year due to insurance coverage, and the market is 4.4 billion, why do we only have 100 million in 2023? Well, the competition that did this was an old company with a new product. We are a new company with a new product, so market adoption will be a bit slower for us. But also, we want to show that there's a lot of potential upside to this. There's a lot of room to grow. And as such, for an exit strategy, companies will give us a high valuation with a high EBITDA multiple of 15x, with a likely 10x return for our investors. Likely acquirers would be these major 4 companies, and we are actually preparing for exit constantly. We are preparing a patent portfolio and are creating a pipeline of products. Taking a look at our timeline, currently we're in the product development phase. That means that we are pursuing verification and validation testing to prepare for FDA submission. Then we will launch our product, the epinephrine, the Epinject, in the end of 2019. Shortly after that, the R&D for our next pipeline product will be very straightforward and simple, and that will be for naloxone to address the opioid epidemic. After that, we plan to launch an epinephrine product in China because they have no current solution for epinephrine, and that is a massive untapped market. We've got some great traction behind us right now. I know that in the keynote speaker, he mentioned that the Amazon Catalyst Grant and Commercial Innovation Fund were great sources for student teams, and back when we were a student team, we got those sources, and we've received almost $200,000 in non-dilutive grant funding. I was even nominated as a Health Innovator of the Year for Seattle, and traction since our last presentation for the semifinals is we brought on a ready-to-wear consultant, Dave Hammond. We brought on a quality management consultant, Alex Cutler. We have brought on 2 engineering interns to help me out in the lab. We've actually established a relationship with BDO, and they're a great firm that's going to help us get government contracts. And they've already identified a BAA that will be a potential great source of massive non-dilutive funding. And they only get paid in the case that we do get the grant as a subcontractor. We've also been accepted into the I-Courts program. This will bring $50,000 of non-dilutive grant funding to the team this June, as well as a partnership with 83 Bar, which is a customer discovery company. So I want to thank you all for listening, and I want to remind you that this is a problem. People can't afford the rescue auto-injectors that they need to survive, and there are preventable deaths. If people had a more affordable version of the drug, we could prevent a lot of these deaths, and with this low cost to manufacture, we can provide a price point these people can afford. We believe that people deserve access to life. The drug is affordable, so why can't the device be affordable as well? Instead of meant to some, we hope you'll help us create a world with meds for all. Thank you.
I'm Lee Otis, and one of the female angel investors here at SAC. Not many of us, so we're recruiting for more. I just wanted to let you know that I took this on because it's a personal problem in my family. My daughter had asthma. And so I want to see how many hands here. Who knows someone who has asthma or an allergy that would actually have to use an Epipen? There we go. So, and a sad story is one of my daughter's good friends is actually in a coma right now and has been for 9 months because he could not afford an Epipen. And he's 24, and I don't know what will happen. But so as part of the due diligence team, I must admit this is an incredible young group, and they've done a lot of work in the last 6 weeks. We've actually got a lot of letters from UW and a lot of consultants that they brought on board. So there's a lot of change, and I'm really thrilled to say that they've actually come a long ways in 6 weeks. So one of those is they just got a letter today by
Co-motion.
yeah, Commotion. And what was that letter?
That's the licensing agreement with Co-motion. So we sent it to our lawyer, and we should start to execute that this
Yeah,
week.
which is one of the things we were waiting on. So here we go. I want to make sure you know that this is a medical device. And I think one of the questions I had, and I'm not going to surprise you on this, but as a medical device, there's what they call, it's a medical device, but then there's an injection, and there's a difference in the FDA approval process. So what they've done is they've gone down the route of an easier FDA approval process, which is actually going to make them more successful quickly. So one of the things that maybe some of you have heard about is the actual article that came out about Epipens in short supply. So what I want them to do is actually answer that question. What would your product do if it was in short supply, and why would that be so important?
Yeah, I did see that article, and it was very unfortunate to see. And I think it makes sense to you guys that, like I mentioned, you can't take the drug out of this when it expires. So that means every single year people are throwing this away. $1 billion of epinephrine auto-injectors are thrown out every year because the drug expires. With our device, you don't throw it away. We're not wasteful. You simply go to your pharmacist for a glass ampule, and you keep the same device. And this will solve the demand issue.
And so you kind of just talked about it in the second question as well, which is what is in the device and what is required at a pharmacy in order to actually make this device loadable.
So to actually make this device loadable, you would get the device prepared by any type of healthcare provider, for example, a pharmacist when you actually pick up this medication. But the pharmacies are incentivized to carry this product because it's also revenue generating with existing CPT codes. For example, for preparation and also counseling patients on how to use the device. Importantly, what we've worked on for the past months is that we've spoken to insurers and we've demonstrated our product, and they've identified that it has such high value and it's such low in cost that having a product like this is a no-brainer. We've talked to pharmacists, pharmacy owners, insurers, people in hospitals. They all want our product.
So I'm sure a lot of you have heard about the opioid crisis we have all over the country. Tell me more about what your product will do after you address the Epipen market.
So the Epinject is our first product, and we're out here to solve public health crises. Everyone's heard about the opioid epidemic, and our next product is an opioid overdose reversal agent. It's an antidote. Currently, the only existing alternatives in an auto-injected form cost $4,500. That's way out of reach of the average consumer. That's why we're going to come out with our next product, which is going to be accelerated through R&D because it's based on our existing technology. Importantly, I just want to remind people that everyone, whether that's your grandparents, a family member that undergoes surgery, or even a tooth extraction, is exposed to opioids. And so this is something that can save many lives, and it's even been emphasized by the government and public health that everyone should have one of these really helpful devices.
Well, I do want to say thank you again. You've been a wonderful team to work with, and I appreciate everything you do.
Thanks so much.
This is John again. I hope that you explore more ways to get more startups to be more effective. So more and better startups, more and better angel investors will make your environment better.